Hey guys, thank you for joining us on this mini workshop, this little webinar, so we can go over the XPRT2ND platform. We're going to go over the business presentation deck. So if you have any questions, I'll be happy to answer them as we go through. Let's get started. So XPRT2ND, it's a second opinion platform for orthopedic surgeons. And why XPRT2ND? So every patient deserves the clarity, confidence, and control they need when we're trying to figure out the healthcare decisions in orthopedic care. So let me just give you the why behind this. So the main reason we started this, or I started this, was because about a year ago, my brother was in the hospital and he was in the emergency room, and they decided that he needed emergency surgery. By the time I got there, I was able to say, I was able to question the surgery itself, and then by questioning the surgery and using my own Rolodex of contacts on my cell phone, I was able to get a surgeon that I knew and I trusted to review his imaging, to review what the current doctor had planned. And based on my own second opinion that I got from a friend, we decided that he didn't need surgery. So a long story short, he was able to avoid that surgery that would have sidelined him for about 3 to 6 months. So think about it. The average person doesn't have access to my cell phone, right? And I'm sure if you're watching this now, if you're an orthopedic surgeon or you are a physical therapist, you have so many family members that come to you and ask you for a second opinion, right? So this is the reason why I want to create a platform such as this, to be able to give the average person the access they need to get this type of care, right? And we know, like, what are they usually concerned about? Did they pick the right surgeon? Is this the best course of action? Will I recover successfully? All great questions that they ask. So let's look at the statistics behind it, right? As you can see, throughout the country, there's an average about 18 million surgeries across the country, of orthopedic surgeries alone throughout the country, right? So that's a big number. So as we did our survey showed that about 30% are looking for a second opinion. So that's 5.5 million, right, that are second opinion seekers. So that's our bet. Will patients pay for the second opinion, or will they pay for that answer that they get from their doctor? Will they be confident about signing up for these second opinions? So why are 30% of patients looking for these second opinions? If we look at it, right, we know, as being in the industry yourself, and as I've known for the last 20 years, right, patients have anxiety about surgery. They're not confident if this is the procedure they need, right? It's a complex decision. Is this something they should be doing right now? And of course, we all understand the insurance barriers that happen through everyone that needs a second opinion, right? Because we know health insurance is not paying for the second opinion if it's not needed. Why pay for a second MRI? Why pay for a second X-ray? Why pay for even a second opinion when it's pretty much cut and dry? But what the insurance company fails to realize is that this 30% of the population is looking for someone to give them some clarity, give them that confidence, right? And we know most of them might stay with their local doctor, but that's fine. They just want to we know that they need to get that procedure done faster to get a result, which would be to their benefit. So our mission statement, right? We want to provide timely, trusted, and accessible orthopedic second opinions, right? We want to bridge the gap between uncertainty and informed decision making for patients, right? And we want to deliver that world-class experience. Because look, in different parts of the country, they don't have access to that best, maybe a top-tier surgeon. They might only have one group in the area, or maybe it's 4 to 5 hours away for them to get access that group, right? So even the groups that we've talked to, they've even said they would refer out to our platform because they want their patient to have access to a second opinion and show them that what they're prescribing them or what they're advising them is the best course of action.